One of the problems of having a very chronic long-term condition such as Ehlers-Danlos syndrome, fibromyalgia, and having obstructive defecation is that when one turns up at A&E, we're often not treated at all well. And even when we are asked what should happen, the doctors then turn around and say, no, that ain't happening. And I think that in this situation, the patient is usually the expert patient. They've gone there into A&E because they're in crisis, effectively, and need some level of urgent admission, possibly, even if it's just a short-term admission, to get on top of symptoms again, because ultimately all patients living with these conditions live with them on a daily basis and have to manage them on a daily basis, otherwise we live in hospital. But there are times when hospital care is necessary, and I do get very angry with A&E doctors because ultimately they're the gatekeepers for getting into hospital, and there are times definitely when an admission is warranted. And I think that certainly this opportunity was missed potentially the other day, but it's been missed numerous times. And guess what? I probably end up having to a return visit to A&E in the not too distant future if I haven't got on top of my symptoms again. And this is where they do need to learn from the patients with chronic long-term conditions, because they know their bodies best. But we've had to go there for further testing, and because we are really desperate need, we wouldn't ever show up otherwise to A&E, and if I was absolutely desperate, it is accident and emergency.